So today we'll be discussing a very interesting question, that is AST, that is aspartate aminotransferases to alanine aminotransferases, what we call it as SGOT and SGPT. So the thing is, normally we know that both this SGOT and SGPT, these both are seen in basically liver. So the difference between the two is this uh, aspartate aminotransferase, or SGOT or AST, is basically found both in cytosol as well as mitochondria. And when it comes to ALT, there is slightly difference. This ALT is mainly cytosolic. It is not found in mitochondria. So what happens with alcoholism, that in alcohol patient, this chronic alcohol toxicity is mainly very detrimental to the mitochondria. So chronic alcohol consumption mainly damages mitochondria. That is the reason why it releases the aspartate aminotransferase, or SGOT, in the circulation to a greater entity, whereas alanine transaminases levels are released less. This is the first reason why in alcoholic patient AST is released much more than ALT. And the second reason is this alanine aminotransferase, or SGPT, which is mainly cytosolic. It needs vitamin B6 or pyridoxine for its synthesis. Now, in chronic alcoholic patients, there is a deficiency of this vitamin pyridoxine, which causes reduced synthesis of alanine aminotransferase, or SGPT. So these are the two main reasons why there is increased release of SGOT, and there is definitely increased release of SGPT, but to a lesser extent. This is the reason why what we very commonly get, that SGOT or AST and SGPT or ALT, this ratio is seen very commonly as 2:1. And whenever it is more than 3 times, it is very highly specific that the patient almost always has alcohol as an etiology. So this is all for today, and thank you so much.